While we're waiting, I'd just like to say Liam Hackett is my name. I'm National Medical Device Equipment Advisor for Community Services for the HSE in Ireland. And today I'm presenting on the medical device equipment role supporting medical devices primarily in the community from an in-house perspective. What we will look at today is we'll outline the present equipment support structure that's in place. We'll look at the governance structure for equipment that is required, and we'll look at how to ensure equipment is suitable for clients' requirements. And we'll also look at providing a cost-effective model to meet the national financial regulations. We'll just continue for the moment anyway. Hopefully we'll get our technology working. Who will benefit from such a project? Well, the clients will benefit. The clients obviously are a very important part of any project, and they will benefit by ensuring that equipment is fit for purpose and that it's safe for use, and most importantly that it is available when required for hospital discharges. The clinicians will benefit by having support from in-house clinical engineering, which to date was not available, and this support will be available for repairs and also for assessment, both in-house and in the patient's home. Sorry about this. And the organisation, the HSE, they will benefit by maximising the quantity of equipment available due to the savings that are made by the in-house service, and it'll reduce the risk of litigation, which is both costly and very time-consuming, particularly on clinicians. Savings, any project will have to show savings, and I'm glad to say that this project is showing savings. What's involved in the community service in Ireland? Well, asset management is the first thing, and if we're not aware of the assets that we have, then it is impossible to manage those assets. And just to give you a quick run through on the process we're working to, we start with the green, in the sense that when the assets are purchased, they're delivered to a central location, they're tagged, they're commissioned and placed on a system and placed in storage. They are on an ICEHTMC system available for issue or for requesting by the clinician. The logistics then, when the equipment is required by the clinician, logistics will pick the equipment, will issue it to a client's account and have it delivered to the home, assembled, and instructions provided. If there's service or repair required in the time that equipment is in the home, that will be provided by the in-house clinical engineering team. When the equipment is no longer required, it's collected, decontaminated, inspected, and if required, repaired. The asset tracking or the asset information is checked, and it's placed back in storage, ready for recycling again. What types of equipment are we dealing with? Well, primarily we're dealing with three different categories. assistive devices, which is the basic day-to-day living needs of the people in their own homes, such as walking aids, bath aids, and appliances. There's the mobility equipment for the disability clients, which is power chairs, manual wheelchairs, rollators, and such equipment, which is essential for the needs of those people with mobility difficulties. And medical device equipment, which is ever increasing in the community. We've blood pressure monitoring, AEDs, monitoring, patient monitoring, CPAPs, BiPAPs, and ventilation for very acutely ill patients that heretofore would have been cared for in the acute environment, but are now being cared for in their own homes. The current service across Ireland, at the moment, we have a lot of colours in Ireland, and it's back down to the different models of care and support for equipment in the country. If we look at the grey-blue side to the left, that's equipment that's an area that's fully managed by Healthcare 21, and it equates to 30% of the population. The yellow is again fully managed by Fannings, and but it equates to 35% of the population. So you can see that there are challenges between the urban and the rural areas in delivering the service. The orange area in the centre, that is the in-house area that we're speaking about today. It may be quite small at the moment, but it is being developed, and the green areas are a combination of both in-house and outsourced contracts, and the other colours equate to different models that are in use in different areas. The types of products seen through service calls heretofore, well, wheelchairs, and that would be manual wheelchairs, power chairs, tilted space chairs, and on all types of chairs. They equate to about 24%. The moving and handling equipment and bed and bed accessories, about 18% each. And mattresses and cushions, again, from foam mattresses right through to air alternating products and rotational products and very high spec products because of those high spec patients, and physiotherapy equipment, and brings up the remainder of the equipment that is looked at. The present management and tracking of the devices. ICEHTMC is the national medical device equipment system for medical devices in the acute hospitals in Ireland and in the community. At the moment, the in-house area supports the equipment through ICEHTMC. However, the third-party systems, because we're outsourced, have different systems in operation, such as AssetTrack, PMAC, Access, and a variety of systems. But most importantly, we're looking at migrating all the areas, irrespective of whether it's internal or external, to AIMS going forward. Question we would ask is, why AIMS? Well, it's just briefly, it's an asset information management system, and it's a modular system, which the back-end module is an equipment management module, which retains all the information on the device itself, including the history, PM scheduling, parts, and any information that relates to the actual device. There's a requester module because the clinician needs to needs to know what equipment is available and to order that equipment. And that requester module is a simple interface that just provides the information that the clinician requires to request and book that equipment for their client. There's a loan store module, which is an equipment tracking to the clients. So the logistics department is able to allocate the equipment to the client from the loan store module on a separate account. So we're aware at any time, irrespective of what discipline requests the equipment, it is in one account, in one patient number for the client. And there is there's an EasyNet, which is a repair request interface. So if repairs are required in the community, the clinician can go online and open a works order by accessing the EasyNet system. All those modules are interlinked in the background, and they're fully compatible and fully interlinked. Why and governance, I suppose, in any system is a very important feature. And what governance do we work to? Well, we work to the Health Product Regulatory Authority regulations in Ireland. We also work to the HICWA standards and the HC Medical Device Equipment Management Policy, which covers equipment in both the acute and the community setting. Lifting equipment regulations, which is the one piece of legislation that we have that we need to comply with in relation to lifting equipment. Health and safety standards. And last but not by any means least, the manufacturer's recommendations, which we continue to adhere to at all times. The challenges in the community. Hospitals, 150 beds, it has 8,500 medical devices. In the community, the local community, which has 300,000 of a population, has 78,000 medical devices on the system, both assistive and otherwise. So the quantity and variation, you can imagine the variation in those devices. The equipment is constantly moving because it's in and out, so tracking is a huge part of it, and a very important part. Client's condition is changing, which requires the upgrading of equipment and changes in equipment. The next two items, access to service tools, diagnostics, and access to service training is essential. So working with the companies, even in a fully in-house service, is vitally important to have a good relationship, because that falls into parts and accessibility to parts and avoiding parts delays. Managing costs, again, working with the companies and in-house to ensure that the costs are contained. Out of our service for the critical type patients that we have in the community now that we did not have heretofore, and managing staff, HR retention. And I'm glad to say that in the 10 years that we have the service going in the Midlands, we haven't yet lost a technician or an engineer. And as any service would go, we're only as good as our last service call, so we have to ensure that our service is second to none at any time and at all times. I showed a slide because it's, I suppose it enhances Ireland a little bit, but Ireland can be a very little insignificant place on the global map. But I believe that the system that we have in Ireland can be replicated anywhere on the globe, because ultimately we have the same type patients, we have the same type of equipment, and we have the same type of governance. So we need, there's no reason why we can't replicate that. I just finished with this slide on team, because in the community, it has to be a team effort. Everything that happens is a chain, and any link in that chain will result in a failure of the system. Thank you.
Questions for Leo?
Is the plan to maintain all community equipment in-house, and if so, how long do you think it'll take?
I don't think that the plan is ever to maintain all equipment, because it's vitally important that we work very closely with the manufacturers and with the service agents. So there is some equipment that is more cost effective to be maintained by the companies, but I would see that we should be in those areas that I showed. We should be looking at 80% over the next 5 to 6 years being brought back in-house. The 6% in the centre might be a small population at the moment, but the reasoning for that is the other areas are under contract. So when those contracts change, then we'll have a big increase. We could have 60% of the population coming in-house in one go.
Other questions? I have one question. One class of equipment you didn't talk about is home dialysis. Is that a separate program, or?
Yes, at the moment in Ireland it's a separate program in the sense that it's not widely used, but it is there, but it is on contract at the moment, and that's one of the services that we would see would be staying external, because we've certain like respiratory, for instance, is again and I didn't mention it there, but respiratory products are rental products, and home dialysis is rental. So where it's a rental product, it will be on contract.
Thank you.
Thank you.